Good day, sir. I'm Aldemidi Espiritu from BSN 1-2, and now I'm going to do the procedure of assessing the musculoskeletal. So, can I start, sir? So, the goal of this musculoskeletal exam helps to identify the functional anatomy associated with clinical condition, thereby differentiating the understanding system involved and could correctly point towards with the condition, helping in early diagnosis or intervention. So, good afternoon, ma'am. I'm Aldemidi Espiritu, a student nurse from Musculoskeletal University, Philippines. So, I will take care of you from 1 p.m. to 3 p.m. po. So, for the safety purposes, may I hold your hand as I check your ID band? So, Ma'am Melinda, I'm here po to assess your bones, muscles, and joints accordingly to the musculoskeletal exam. So, I'm going to touch some of your body parts in order to have a proper assessment. So, Ma'am, if you have any question during our assessment, you may ask po after we done. So, this is to ensure that the patient receive an intervention. So, before we get started, I'm going to perform a hand hygiene in order to prevent the spreading of microorganisms. And before that, I'm going to close the doors for you to provide a privacy. So now, ma'am, I'm going to ask some few questions regarding to your health status. So, do you have any family history of joint disease such as rheumatoid or osteoarthritis? So, do you have any muscle pain if there is a redness or swelling? So, how about naman po, do you experience that there are times that there is a limitation in your movement or inability to perform a daily activities po? Inability to perform activities in daily living po. Okay po. So, thank you, ma'am. So, now we will start na po to move on with our assessment. So, we will start po to inspect for the muscle size, and I will compare it po on one side of the body and at the same time to the other side po. Okay? So with the use of the instrument of tape measure, I will use this to see if there is a muscle discrepancy po. Tayo na po tayo. So yung centimeters po natin na ano yan. Okay. Okay. So, upon the inspection, the patient has an equal size on each body size. So, now we will move on for the muscles and tendons to inspect for the constructors po. So, tayo po tayo, ma'am. So, lakad po tayo ng abante. Pabalik po. Then, tiptoe naman po, ma'am. Nakatingkad. Okay. Okay na po. So, yung heel naman po, ma'am. Okay, go. Okay na po. Thank you po. So, upon the inspection, the patient has no constructures. So, now we will proceed naman po for the muscle for tremor. So, all you need to do is to place your arms out in front of your body. Sige po. So, relax lang po. Okay, thank you po. So, as I can see, the patient has no fasciculation or tremors. So, now po, we will proceed naman po to test the muscle strength po. So, all you need to do is to press my index and middle finger. Okay. Okay na po. So, upon the inspection, the patient has an equal strength on each body sides. So, now in sitting position, we will test po the sternocleidomastoid. So, I will place my arm. Then, tingin po kayo dito. Okay po. So, kabila naman. Wait lang po. Okay. So, ma'am, ayos na po tayo for the trapezius. Pataas na po ng paa niya doon. For the trapezius, all you need to do is to shrug your shoulder. Taas mo po. Taas mo yung shoulder niyo po. Ganon. Ganon po. Okay. Then, I will fly upwards. Okay. For the deltoid naman po, ma'am, all you need to do is spread your, then I will try to push it down po. So, for the bicep naman po, we're going to, for the bicep, then, I'm going to place my arm po, and then you will try to extend po. Wait lang po. 1, 2, 3, go. Okay, sa kabilang side naman po. 1, 2, 3, go. So, for the tricep naman po, you're going to try to flex naman po. Okay? I will press of course. Sa kabilang naman po. Okay, thank you po. So, for the wrist and finger muscle, all you need to do is spread your fingers, and I will try to close po. Okay? po. Kabila naman po. So, for the grip test strength po, all you need to do is to hold my index and middle finger and I will try to pull it down. Okay, thank you po. So, now, we're going to the lower extremities po. So, higa na po tayo. Okay, ayos na lang po. For the hip muscle po, we're going to lift your one leg. Lift niyo po yung one leg niya. Then, I will try to push it down po, okay? Okay, sa kabila naman po. Okay. For the hip abduction naman po, tagilid tayo ma'am. So, you're going to spread your legs apart and I will try to wait lang po, I will place my hands in the lateral surface. So, okay pa, go. Okay. So, for the, wait lang po, hindi pa po yan. For the abduction po. So, you're going to bring back your legs together po and I'm going to place my arm in the between of your leg. Okay? Thank you po. So, okay na po. Balik na po tayo sa natin. So, for the hamstring naman po, ma'am, you're going to bend your knees together and I will try po to straight your legs po. Okay? Okay, thank you. Kabila naman. I will try to straight po. Okay, thank you. So now for the quadricep po, it is in a partially bent. Then I will try to flex po. Okay. Sa kabila naman. Okay, thank you po. So for the muscle of the ankle and feet, I will try to apply a downward force for dorsiflexion. Okay. You're going to ganun na po yung paa niyo po. Okay, I will apply lang po. Okay, go. So, for the left. Okay. So, for the plantar flexion, I will apply naman po upward force on the sole of your foot. Okay. Sa kabila naman. Go. Okay, thank you po. So, now we will proceed naman po to assess the bones. So, now I'm going to inspect for the skeleton structure. So, all you need to do is to relax and I will try to inspect po. Okay. Okay. Okay, thank you po. So, as I inspect, the patient has no deformities. So, now I will palpate naman po for the bones to locate if there is any edema, areas of edemas or areas of tenderness. Okay po. I will unpose a bone. Okay, for the upper extremities muna tayo. So, as I palpate, the patient has no areas of tenderness or swelling at all. So, now we will proceed naman po to assess or inspect and palpate the joint. So, I'm going to inspect po your joint for swelling and palpate it to see if there is a tenderness, smoothness in movement, crepitation, presence of nodules or swelling. Okay po, we will start po here to see if there is a open niyo po yung mouth niyo po. Okay, move side and upward. Okay. Okay po. So, move naman to see if there's swelling. Okay. Naman. Okay, thank you po. So, upon the inspection and palpating, so the patient has no swelling no presence of nodules, and areas of tenderness. So now we will proceed naman po to assess the joint or the range of motion of your joint. So I will using my goniometer of mine, which is to measure the angle of the joint in degrees. So now ma'am, for the elbow joint or range of motion in the elbow, it is in the hinge motion which allows the back and forth motion. So now we will try to do the supination. Okay. Okay, the facing downward. So for the supination. So for the left po. Okay. Thank you. So now we will proceed naman po for the shoulder po. So for the shoulder, it is categorized in a ball and socket joint, which is allows to move freedom, which is a greater freedom of movement than the other joint. So now ma'am, patagilid na lang po tayo. So for the flexion po, I will place my hand in the scapula and clavicle, and you need to do in the 90 degrees. And I will use my goniometer. Okay, so try to fully raise po ma'am sa pinakataas po. Okay, which is in 180 degrees. So now we will try to extension naman po. So your arm will backwards naman po. Okay, so I will naman. So it is in a 60 degrees. Okay, thank you. So for the abduction naman po, all you need to do is to raise your arm in the lateral. Go in a 90 degree. And try to fully raise po ma'am. Fully raise po, pinakataas. Okay, completely. So now ma'am, for the horizontal adduction, you're going to do the front flexion, which I'm going to push it in a 20 degrees. Okay. So for the horizontal adduction, so I'm going to do the lateral surface and I'm going to push it backwards, which is measured in a 15 degrees. Okay. So now for the external rotation rather, I'm going to hold this humerus and the wrist in a 60 degrees. Okay. So now, ma'am, talikod po tayo para po maano natin ang dito po tayo ma'am, talikod. So for that, we will try naman po to a 100, ilagay niyo po sa likod in 100 degrees. Okay? So now we will move on naman po to the hip joint, which is a hands-off assessment po, which is associated with ano po, with ball socket motion. Joint. Okay, that's po tayo po. So for the flexion po, close your knee to the chest po. Okay? Okay po. Thank you. Sa kabila naman po. So, it is in a 110 degrees. So, for the abduction naman po, or the adduction, you're going to do is to lift your one leg and try to cross the beneath leg po. Yung nasa ilalim po, i-cross nyo po. Okay? It is in a 15 degrees. Sa kabila naman po. So, it is in a 15 degrees also. Okay? Sa kabila. So, now for the abduction naman po, you're going to off your leg to the bed po, palabas po as far as you can po. Okay? I'm going to ano naman po, to measure. So it is in 50. Okay, 50 degrees naman po siya. So for the internal rotation, you're going to lift your leg and try to move in outwards po palabas. Okay, I'm going to measure it. So it is in 30 degrees. So kabila naman po. Wait lang po, ilip nyo muna po. Then outwards. Okay, isang 30 degrees. So now po, ma'am, for the external po, you're going to inwards naman po. Inwards po, papasok. Okay? So, ano? So, ito yung 20 degrees. Sa kabila naman po, inwards din po. Okay, thank you po. Okay, thank you po, ma'am. So, now for the extension, ma'am, roll over po kayo, talikod. Dadapa po. Okay, so we're going to lift your leg po. Lift po, lift. Taas niyo po. Okay? It is 15 degrees. Okay? Ganyan po. Taas niyo po. It is 25 degrees po. Okay na po. So now for the knee, for the range of motion of the knee po, ihaya na po kayo, ma'am. For the range of motion of your knee, so all you need to do is to flex. For the flexion naman po tayo. Yung knee nyo, yung paa nyo po, ilagay nyo po sa may, iabot nyo po dun sa may puwetan po o sa buttocks. Okay? Okay. Okay. It is in a 120 degrees. Sa kabila naman. Okay? Thank you. So, now try to imagine po for the extension po. Try to imagine that there may pader po dito and try to push it down po. Okay? Try to push it down po. Piling nyo po may pader. Okay? It is in a 10 degrees. Sa kabila naman po. Okay? Thank you po. So, now po, we're gagawin po natin ito in a sitting position po na nakahang po yung paa nyo. Upo na po tayo, ma'am. So, nakahang yung paa. So, for the extension, raise your patella po. Raise your patella. Okay. For the flexion, downward your patella. Okay. Kabila naman. Okay, pababa naman po. So, for the internal and external rotation, I will touch your tibia and ito. Okay, to the external, outwards, external, outwards. Okay, ito naman po sa kabila. External, outwards. Thank you po. So now, ma'am, we're done naman po with our assessment with the joint. So for the overall findings po, seems to be normal and there is no abnormalities found. And this assessment will be confidential between the physician that will be assigned to you. So, do you have any question, ma'am? Okay, thank you po. Thank you for the cooperation, ma'am. And God bless you po. Ingat po sa pag-uwi. So, sir, I'm done with by assessing the musculoskeletal. So, thank you, sir.